first, why are we making this change? And to help explain this, I'd like to invite Dr. Robert Habig up.
Thank you, Joe. And again, thank you all for coming, sharing your time. So I know very limited and lots of things to do, but really an honor for all of you. And this is our fourth great crowd here that we've had to explain. Well, I'm the old guy, so I kind of started out here because we kind of started back in 1980. But I like to ask just a question: is why? Why these accomplished people here behind me, who have over 100 years of practice experience, have 6,000 patients that we get the honor to take care of. We're busy. We can't get anybody else in. We run late every day. Why would we be changing at this point? Where's the need? Why? We're going to answer that because there's something very exciting to share with you tonight, something that is a new wave in medicine, and I hope we can point that out and not take too much of your time. But it is exciting. We're excited. Our staff, wonderful staff, we couldn't do it without them, are excited too. We weren't always busy. Back in 1980, in fact, 3 days from now, October 20th, 1980, I started in that building down there 36 years ago. Wasn't real busy. I saw 3 people that first day. It was a great day, though. I always remember 2 of those people are still active patients. 1 just moved away. We built that, did obstetrics and delivered babies, which was a great 10 years of that. In fact, I have the supreme honor of taking care of a baby I delivered, which is really exhilarating. That makes medicine fun. So all this accomplishment, great medical schools, great residencies, some of the best in Indiana and Illinois sitting here behind me, accomplished. Why would we want to do this? We're going to tell you about that. 1984, I attracted my very first partner, Steve Pennell, was with me through 2005, a great man, great doctor, moved on to try other things and do other things. 1989, he and I found Dr. Mary Pat. We found her in the emergency room, not seeking help, but giving help. She was too good. Very accomplished emergency room physician. But she was a better family doctor. And we saw that. We recruited her, and she's joined us and been a great addition ever since. The 3 of us went forward in 1997, found Carla Erickson. Learned, accomplished, anyone that's had any type of contact with her knows her expertise, a great addition. Then our latest addition, 2009, someone I get to spend my nights with, as well as my days now. Married 37 years, a beautiful lady, Dr. Elaine Habig, accomplished internal medicine specialist, great training program, took Witham Hospital in Lebanon from being a first aid station to a renowned hospital. New procedures, new programs, one of a kind. But she was gracious enough to join us when we had an opening in 2009. So here we are, we raised our kids here. Got one of them right here. We've got 2 of them. I think there's 2 of them here. They went through this very high school. Loved it. Great education. We thank this community and the school system over and over. It prepared them for great colleges and great postgraduate work. But I actually started back in 1958 as a little kid over here on Cary Road when Dad took my 7 brothers and sisters and me and said, we got to keep these kids out of jail. We got to keep them off the streets. We need to make them farmers. So we bought this nice 120 acres, and we worked that, had a great time, many memories. 40 acres is still available. The Family Trust gives it to the youth of this community to use free of charge, now going on 30 years. We love it. Play soccer and baseball. Perhaps many of you have been exposed. We'll keep it that way as long as possible. So why? Roots, great practice. It's because we have this addiction. Yeah, we all have it. Okay, but it's not alcohol. It's not tobacco. It's not a substance. Our addiction is the passion for what we train for, right to our very soul, our hearts, the roots of what we train in primary care to take care of you. That's what we love to do. We have that burning passion. and we're not going to let it die. But something's happened over the last 20 years. It started off as just a nuisance in the exam rooms. Maybe like one of those little cute organ grinder monkeys. Cute, not really a bothersome, not too much of a trouble. But that menace, which is invisible to you, but it plagues us every day, has grown into this horrible, horrific, menacing gorilla. It's the gorilla that sits in every exam room. We feel it, we see it, we sense it. It's that gorilla saying, you can't order that for Mr. Jones. You can't do that test. It's right. It's the insurance companies. It's our government. They have taken over. They rule every exam room. They're menacing. They use our time up. They take our time away from you. And this is what hurts us. You say, well, wait a minute, you always give us time. I had a patient today. I say, well, but you're always there. I said, check your watch. Okay, how late am I? We always run late. Why? Because we do try to answer. He had a list about that long. We got through all of it. But what happened is I stole time from room 3. And exam room 1, I could hear him preparing somebody in there. I stole time. We all do that. We steal time when we run late. And we run later. And we insult you. And we delay you. And we ruin your days. Perhaps a PTO day. A day you can't afford to sit. Has anybody ever fallen asleep in our waiting room? We've all walked in and had somebody dozing in our exam rooms. This breaks us because we don't like that. That's not good care, and you deserve better than that, so we have to find a way. Our typical day, we may start on time. Hour into it, though. We're running behind. You all know that. We can be an hour behind. We apologize all day long for ruining your schedule. Some people have to leave. That's really sad. So we're going to change that. We have to change that. Time is of the essence. Time is what the gorillas have stolen away from us, and we're going to get it back. Because if we don't take the time, I miss that malignant melanoma that I found 2 weeks ago. Why? Because we're running late. And John came in and said, you're running late, don't do my physical. I said, no, you are here for a physical. We're going to do your physical. He says, don't bother about it. I'm healthy. I don't have a problem. I said, no. He's getting a gown. He was going to leave his T-shirt on. I said, no, your T-shirt needs to come off. Doc, you're running late. I don't worry. No, your T-shirt needs to run. That was where I found the malignant melanoma. Right on his back. He never knew he was there. About a 1/4 inch. That's a save. That's a lifesaver. I'm not beating my own chest. We all do that day in and day out. It was less than 3 years ago. Tom was in. There for his physical. Doc, you're running late. Don't worry, we'll reschedule. No, you're here for your physical. And that dreaded glove was laying on the counter. And he said, do you have to use that? I said, that's part of our physical. That's why you're here. And he hemmed and hawed, but you're running late. I said, I don't care. Okay? We'll make it through. If I had not done that exam to finish that complete exam, his cancer that was found on that exam would have been missed. He's living today. He gives me a hug every time he comes in. He said, you saved my life. I said, I didn't save your life. You saved your life. You came in here. But we took the time, and that's what we're going to claim back. That's what we're going to do. So 2 years ago, we started talking and said, we have got to do something. Something's got to give here. We could quit. Okay? We don't look old, but we're old enough to quit. And then I remember my ophthalmologist. He sends me a note every spring. I open it thinking he's going to retire. I open it. No, letter from Paul Honen's office in Lebanon. Time for your exam. I go to my exam. I wait in his waiting room. He comes in. Hi, Paul. Hi, Bob. Paul, are you ever going to retire? He goes, I'm 92. I feel good. And I'm thinking, is his eyes good enough to see my eyes? But what a stellar fellow. What a fella. And he always says the same thing. He says, my daddy told me when I retire to do something I love. And he says, for 30 years, I guess I've been retired because I do what I love. I mean, what What a fellow. So retiring is not an option. No, we're going to keep going. We're not going to let these gorillas chase us. So what else can we do? Well, we looked and we examined, and for 2 years we have probed and pushed and tried different models, and we found something. It's exciting, and it's called direct primary care. As I was the very first family doctor here in Westfield, we are going to be the very first direct primary care of this kind, perhaps in the state of Indiana. We know of no other like it. But regardless, it's very unique, and it's for you. And so listen to us this evening as Dr. Mary Pat explains what is direct primary care, what is Westfield Premier going to look like here starting December 1st.
I think I'll take it. I just pointed at the thing. Okay. Good evening. Thank you, everyone, for being here. I'm Mary Pat Forkin, and I've been with Westfield Family Physicians since 1989. And Dr. Bob has become a great friend and a mentor all these years. I actually was working the emergency room up at Witham Hospital in Lebanon from 1986 to 1989, and was fortunate to meet his wife, Elaine. So I knew Elaine before I knew Bob. And several times we had lunch together. And she had told me that her husband and partner, Steve Pennell, were looking for another partner. So I really liked doing the emergency room. I didn't like the fact that I didn't have a lot of follow-up with the patients as to what happened with them. But finally, I decided, after she asked me about the third time, out of courtesy, to go and to meet with Dr. Bob and Dr. Steve. So I went and met with them, and probably it was less than an hour, and I knew that that's where I wanted to be. We had one meeting, no dinners, no wining or dining or whatever, and I decided to come home because I was going 30 miles away, and I still live 1 mile away from the office in the same house, and have been with Westfield Family Physicians ever since. I did my training actually in Missouri, did my school in Illinois, and so that's kind of where we are today. And I want to tell you now that we're Westfield Family Physicians, we are going to transition to Westfield Premier Physicians as of December 1st. So what does this mean? Well, direct primary care means just that, direct, between you and I. Primary care, again, internist, family docs, nurse practitioners, and we take care of practically, of most people, 80% of your care can be provided by primary care physician. So what we'd like to do is to get back to, Joe, slide, sorry. So I'm going to do a little bit of a quiz first as to what do these numbers mean. Does anybody know what 30 to 40 would stand for? Yes, patients per day. So that's about the approximate number that we see patients per day. Anybody have any idea with 2,000? Before you answer that, it's not 2,000 seconds of wait time, because you would be happy with that, because that equates to about 32 minutes. Anybody? 2,000? Yeah, actually our patient panel. So that's the average number of patients that a family physician usually cares for in a year's time. Okay, this is our healthcare system. It's a mess. And since Obamacare came into existence, all the blue dots that you see on there have been added. This is insurance companies, regulators, government agencies, even the IRS, you'll see in the very top. And worst of all, if this is my 10 by 10 exam room and all of this is in there, you've got the President of the United States and Congress also in the room with you. So can anybody see where the physicians and the patients are in this diagram? Let me help you. There's physicians. Patients are way over here. And I bet you no one can find a direct line that goes between the physicians and the patients. So what has happened with our system over the years is back in the 50s and 60s, even into the 70s, people had health insurance that was really for catastrophic things. It was called major medical. Then in the 70s, into the late 70s, early 80s, people started wanting their insurance to cover more. And it's gotten to a point where they wanted to cover everything, even your office visits, your analysis, everything you want covered with your premiums. So I'm going to make an analogy here and ask how many of you have auto insurance? Hopefully all of you do. How many of you have homeowners insurance? And how many of you have made a claim in the past year on either your auto or your homeowners insurance? Okay, just a few, which is fortunate for the rest of you. So think about that. You're at the end of the year, you get your new bill to pay your next year's premium for your auto or your homeowner's insurance, and you kind of think, wow, I spent all that money and I didn't get anything out of it. So some people would say, well, you know, I really think as much money as I'm paying, I ought to be able to maybe at least occasionally get some gas. Definitely should be given a chance to have an oil change, and maybe every 60,000 miles, my insurance company should be providing me a new set of tires. Or your homeowner's insurance, where you made no claims and you think, wow, all that money to waste, I never used it, which is why we should really be calling it reassurance, because it's reassuring to know that it's there if you need it. And you might say, gee, I think that I should really get my money's worth. Let me have them give me new carpet every once in a while. Well, I can guarantee if that's included in your premium, it's not going to be the grade A type, because they're going to decide what kind of carpet you can have if they're paying for it. And if they're providing your oil, it's probably not going to be the guy that's down the road from you. They made a contract with someone halfway across town. But that's what exactly, as ridiculous as that sounds, that's exactly what has happened with health insurance, where it's covering everything. And again, remember, 80% of your care is taken care of by primary care physicians. And it's the least expensive care that's out there compared to all the other specialties. So what we'd like to do is to get this, again, imagine this diagram is a 10 by 10 exam room. We'd like to get all of these people, all of these agencies, regulators, out of the exam room and put the patient and the physicians where they belong, right here in the middle, communicating back and forth, okay, and not having any insurance company telling you what it is that they're going to cover for, because it's going to be the bare minimum. It's not going to be necessarily what you need or what you like to have. So again, physician and doctor, away from all of these people, all of these agencies who have interrupted us and gotten in our way these past years. Now this is a picture of Norman Rockwell. Most people are probably familiar with it, and I received this as a gift when I graduated from medical school back in 1980. It's in my office, and it means a lot to me. Now I have to tell you, my son looked at that recently, and I think he was joking, but he said, oh, poor little girl, the doctor's going to have to tell her doll really isn't alive. But this reminds me of when I was growing up. I wanted to be a physician from as long as I could remember. I never knew anything else. I was one of 8, and anytime any of my siblings were hurt or sick, I was the one that always got to go with Mom to the doctor, and I never ever left his office without some type of a first aid book or Band-Aids or something like that, because he knew I was interested in medicine. And I can remember it just seemed so hassle-free. I can remember going in, we'd see the doctor, we'd get done, we'd go out to the desk. I never remember a lot of exchange of papers or anything like that. My mom would chat with the nurse, would chat with the receptionist, and out the door we would go. I do remember again that this physician was our primary care physician, our family doctor, and at that time he would even set bones and things like that that we needed. And I admired that, and I really have strived to be like that with my patients, where it's one-on-one, where we take the time that we need, but as Dr. Bob Habig said, that oftentimes makes us run behind. So we want to get back to being your personal doctor in the office, in the hospital, communicating more with specialists that you see. That's another thing that's really gone by the wayside. So many specialists are so busy and they figure, oh gee, your doctor's going to find out, I'll send some paperwork, they'll get on the computer, they'll figure out that you've been here. And very rarely pick up the phone to call us to let us know what is going on with you. Same with the hospitalists. Sometimes we don't even know our patients have been in the hospital until after they're out and they call for a follow-up appointment. And those things need to stop because it's that direct communication with our specialists, other people taking care of you, our hospitalists, that are really going to make your care, okay, the best that all of us can provide to you. And that means that your primary care doctor, either Dr. Elaine, Carla, myself, or Dr. Bob, we want to know what's going on with you. And we are going to make sure, especially with our new model, that every one of our specialists, every hospital that we have our patients go to, are going to know that we expect to be called and notified when one of our patients has anything serious in the emergency room or is admitted to the hospital. So the difference between the direct primary care and insurance-based care is we will no longer be billing, we will no longer be taking insurance, we will no longer be taking Medicare. And Dr. Elaine is going to go into more detail and explain exactly how that works. So I'm going to introduce Dr. Elaine Habig, and she will take it from here. Thank you. Do you want that?
Hi. It's nice to see you, and some people I haven't met, but many I have, familiar faces, John and some others out here. But my part is going to be more the nuts and the bolts, and what in the heck does this mean for me? You're all sitting there and you're going, well, this is really interesting. And yes, it's probably time somebody did this. And we've had many people say, I am so proud of you for standing up against the government and the insurance companies. But for me, I'm just not sure yet. Well, let me tell you, it's time we quit drinking the Kool-Aid, the federal Kool-Aid. We have spent over $580 billion in this country, and this year alone on, guess what, Medicare. And it's predicted in another 10 years it'll be over $1 trillion. Well, right now, our Medicare expenditure is the same as the national defense budget. And the bad thing about it is it's mostly wasted. If Dr. Forkin was saying how primary care, those people of us in the trenches with you, how we account for 80% of the care that can be given in the primary care office. Do you know how much of the federal budget for spending goes for primary care out of all, nationally, that's including everything, 4%. And I've heard it said that the other 96% is spent on the mistakes that could have been found in a primary care doctor's office. So the other 96% is spent on nursing homes, emergency rooms, specialists, surgeries. And we always had a saying where I worked is that, and this is in the whole world of care, is that the cheapest patient, when you're looking at patients as a budget, like the federal government does in our insurance company, its expenditures, the cheapest patient is, do you know what kind of patient? Who said? I didn't quite hear that. The cheapest patient is the dead patient. Okay. And the next cheapest patient is the healthiest patient. Because if you're healthy, we can take care of you for a solid year for what it costs in 15 minutes in an emergency room. Here's a game playing. The average emergency room cost today is $5,000. $5,000. The average hospital day per day is $2,000. We now have babies that cost $70,000 to have a baby. We have colonoscopies that cost $10,000. It's funny money. It's crazy, but it can't keep going. And when we're promised this by insurance and our government, and now we want to put everybody into the pool, guess what, guys? There's not going to be anybody to take care of them. And somebody said, what caused this, guys? Did Obamacare push you over? And I said, yeah, pretty much so. But you can't expect people to be there, doctors, for everything that's happening right now. So as you end this year, there'll be 35,000 less primary care doctors in this country than what we need. So we are doing something which is bigger than us, not to scare you, but it's much bigger than us. What we're trying to do is our part to put freedom back into healthcare and to save this situation. We could otherwise ignore it. So quit drinking the Kool-Aid. The things we hear from people is, gee, it sounds interesting, but number one, I really am healthy. I'm not sure I need this. And number two, I'm not sure I can afford it. I get mine all paid by my Medicare. I don't pay a penny. So I just feel like maybe I need to go down the street and find somebody else to take care of me. So we're going to talk about that. Those are some interesting facts here. First of all, a little about me. My name is Elaine Habig. I got into medicine by accident. I was a musician and an organic chemist, and that's what I was doing. Happened to go back and talk to a professor, said, have you ever thought about medicine? I said, no. I made one application. I got into one medical school, and the rest of it is history. So from my background, I like to put things together, like new programs, like this, so blame me. But I put the first hospitalist program in the state of Indiana together. I put disease management together. I was medical director for American Health Network when we had 50,000 managed care lives and 300 physicians. A lot of experience in both the insurance industry and in the health industry. At Witham, I was chief of staff twice. Not any big deal, just a lot of paperwork, but also was putting in pacemakers, ventilator management, intensive care, and on-call every third night and every third weekend for the 30 years of my life. So I know what it's like to be in the hospital, and I know what it's like to keep people healthy and keep them out of the hospital. And that's the difference in what we're doing and what other people do. Okay, we're going to do a little game here. True or false? Health insurance is the same as health care. False. Or the other way to put it is, I have good health insurance. That means I have good health care. So wrong. We can give you example after example on this, on where you've got good health insurance, but if you don't have good doctors, and if you don't have somebody that gives a rat's bottom about you, and you're just another number on a line, do you think you're going to get good health care? The answer is no. You know, your life, there's only 3 important things in life, folks. If you find more, let me know. But I've watched a lot of people die over the years, and there's 3 things: your family, your faith, and your health. And you cannot go cheap on health. We have a saying, actually, that I got from my son, because right over here. 2 things. One, I put a pacemaker on the night before he was born, so I was on the table out here with one of those big lead aprons and got home at midnight, and he was born at 7 a.m. So I have continued to apologize for the possible radiation that's affected his brain. Anyhow, he has a saying that apparently has gone around in the fraternities, and you may know this, and there's 3 things you don't go cheap on: brake pads, parachutes, and birth control. Now, some of us are beyond that, and I won't ask how he says this. I don't know. But anyhow, there's another one you don't go cheap on is your health care. And people ask me, hey, Premier, you know, time marches on. We're now going backward. And we are finding the people that are in control now are saying we've cut the heart and souls out of our doctors, and we've tried the big way, top-down management, and we've got all these layers in between, and guess what? It's not working. So they're acknowledging it. It's just unwinding that big maze. And that's what is happening here. When it takes me a bill, I have to send a bill to 6 places before it gets back to me for a $10 fee. That's crazy. And when you look at what people get paid, I don't make any different than what I made 20 years ago. Our nurses don't make much more. And some of our nurses have been with us over 20 years, right, girls? Yeah. And so where is it? Why is it so expensive? Layer after layer after layer of unnecessary things. So if we're going to fix healthcare, we don't do like one of our candidates, just say, well, we'll just throw them all in together and put Band-Aids on the system. That's like slitting somebody's throat and sticking a Band-Aid on it. You've got to simplify it. And the way you simplify it, you still have your doctor, you still have your patient, but you cut out all that middle garbage because we don't need it. And that's where direct primary care comes in. I used to say I could see somebody for $15 a visit if we didn't have to have 70% of our time and our expenses go to all those layers. That's what we're trying to do. So you're going to say, well, that's great. It's a lot cheaper. Yes, Ben Carson, and you guys know who he is, and he said that concierge, this is the way to go. We could pay all the Medicaid and everything else by the money we save by keeping people out of the expensive things. So we're all rah-rah, but when it comes back to you, you'll have a decision to make. One, are you going to go with better care with people that you trust to take care of you? And the question is it going to cost me more? Well, it's Premier. It very well may, but many times you get what you pay for. As everything catches up, it's going to take a while to get the government to catch up, if they ever do, because I haven't seen the government simplify anything quite yet. So we are doing it, and so what I want to talk to you about is how we're doing it and how it's going to benefit you, even though the cost may be a little more. You got this one. This one's false. Whoops. Got to go backward. Okay, so so we're talking about, some people say, well, you're just charging me more money for the same care. And we're saying, no, these are the benefits you get out of what we're planning on doing. Independence. You no longer have to go home and have that bill come and you don't know if it's going to be paid or not. You can stay in your own home now because you know you got a doctor down the street that you can call 24 hours a day. It's the things that we want to have as independence, that we can take care of ourselves. Security, again, knowing who you can trust. We are all about lifestyle. Now, when we're talking about an annual physical, and we'll talk about that in just a moment, people say, well, I already get an annual physical. I already get labs. Why would you charge me a monthly fee for that? The annual physical we're talking about is not whack-a-mole. We do a good job on care, I agree. But wait till you see what's going to happen when we have more time. Whack-a-mole is what we do today. You're sick. I've got a cold. I got to go to the doctor. Or I've got to go down to the Minute Clinic or something like that. And you get medicine and you go home and that's it. Or you have a sore toe and you get taken care of. Or you have a heart attack. Those are all after the fact. Those are crisis management. What we want to do is have the people in this room have preventive, focused, I can stay healthy. I'm going to be taught how to take care of myself. You give somebody a fish and they eat the fish. You teach them how to fish, and that's the difference. And so what we want to do in our preventative, personal, comprehensive, annual, and our annual wellness plan that we're doing throughout the entire year is teach you how to take care of yourself and monitor you and check with you and make sure you're doing fine. And that's the big difference. It's a whole different program trying to keep people healthy than whacking a mole. You can see some of the others, and I think you will agree that this is what we want to do. This is our goal on what we want to do in the future. So now here's the next one. I can trust my life to anyone in a white lab coat. True or false? Okay. I one time gave a prescription to a patient, and she came back furious because her husband went to pick it up, and her name was Kitty Smith, and she came back and said, Dr. Habig, they gave me worm medicine. So it was some other Kitty Smith. It was for the kitty cat that she got. So you can't always trust yourself to somebody in a white coat, be it pharmacist, doctor, veterinarian. Nurse down at the corner drugstore. We have multiple cases of people who did this, and they got seen by a committee of people, and it wasn't exactly who they could trust. So if you have a doctor and you trust your doctor, it's a relationship that you should really enjoy and take care of, because sometimes it's not easy to find a good doctor. And I tell our patients, if you decide this is not for you, fine, but don't do like one of my patients that said, well, I'm signing up for somebody with a name I can't spell, it's got too many letters, and she got trained in the Caribbean. Do you think that's good? I have no idea. She may be wonderful, but don't trust your life to somebody unless you know what you're doing. Life is too short. Okay, the next one. Now, what to expect? So you're saying, okay, well, what are you doing that's different and has value to it? Well, we talked about it. It's having a trusted relationship with a doctor that you've already got a track record on. And as somebody told me today, you care. It's obvious we care, or we would not be here. All of us are pretty darn people. I think we all have good faith, and we have good families, and we feel like that we have a God-given talent on what we do. That's why we're here tonight. This is important enough to us that we do not want people to come along with us with numbers. If you don't believe in what we're believing, if you think you can go to a street corner or get your health care somewhere else for a cheaper price, then please go. We want people to come along with us that believe in this, because we have people watching us from other states and other practices as this whole program takes off. There's over 5,000 programs similar to ours, not exact, in the country, and it's the fastest growing program. So everybody's going to be watching us, so we want people of like mind to do this. Here's some things we're giving. These are some value. No longer do you have to come into a parking lot that has potholes in it. No longer do you have to come into something that looks outdated. We are going to do more renovations. Our waiting room is going to be very comfortable. It's going to be a time of rest and relaxation, but you're only going to be there for 1 minute because we are taking you to the exam room or wherever we are. So we're going to stop waits. We're giving you time to spend a few good years if you're short on years. Time to come in and not waste your day. One thing I want to do in the future is to even help with travel transportation, so we don't have to have people transporting their parents and wasting a whole day. In the waiting room, time wondering when you're going to get called back, time wondering what's going to happen to you. It's the time factor that we think is so important, time for your life. The same-day acute visits, you call, you say, I'm sick, can I get in? Of course you can get in. Come on in. On-time appointments, relaxed, unhurried visits. No longer do you have to have us jingling our keys or people interrupting or anything like that. And here's something, as we talk about costs, people don't realize there are no copays. When you're paying on a monthly, you don't need your checkbook. You leave it at home because you don't need it. And no copays. Some copays are $75 a visit, by the way. And some people sign up for our insurance, and they've got $50 specialist copays. One patient of mine has cancer. He has to go in every 2 weeks. He's almost bankrupt from the copays. We're going to eliminate all of that. The health and wellness, the other part is the discounted fees, because you will have a choice. I'll tell you how this runs, but you will have a choice to enjoy our discounted fees, up to 70% in many cases. So those are the things, and something you've asked for, a live person on the telephone, we are going to have that. No more automated operator. We have 3 things that we offer you as far as care packages are concerned. And this is a side-by-side of them. You may say, what is a care package and why are you offering care packages? Other doctors just say, charge a fee, and that's it. Well, one, we want to make sure you get your physical done. It would be so easy to just say, okay, $50 a visit or $75, thank you very much, you can pay on your way out. But people don't do things then, like get their physicals where we can keep them healthy. This way, we provide the physical free, it's included. And your physical also includes a certain number of labs. You'll be able to see, there's a whole bunch of labs on the website that you can see in each package what's included. That's no additional charge. So we can assess you, we can educate you, we can monitor, and we can treat you. And to do that, you have to know what your patient has in the first place. That's the reason we're doing the comprehensive physical. Not because we make any more money for it, because we don't, but because it's our job to keep you healthy, and that's where it starts. So a comprehensive physical, 3 different classes of care, and we'll go into those. We did this because we think that people should have the freedom to choose what kind of care, how much care that they need, not something that says you're 68 years old, so you're paying the $150 a month on it. Okay, let's look a little bit further. I'm going to go through these rather quickly. These are our 3 programs. Classic care is for the very healthy person, the person that may have 1 or 2 prescriptions, but mostly healthy and only needs to see the doctor 1 or 2 times a year. So that's not some of you. You're going to know who this is. But that person, and we'd have a fee on that. That includes their annual exam. That includes the labs at their annual exam. And that includes one visit in the middle of the year. So now people feel like I can come in the middle of the year. People say, well, that's great now, but what happens if I want to have another visit? Well, in our a la carte menu, which I don't know if I have a slide of that, but it's on the website. We'll get it to you. But you can get another visit. If it's less than 15 minutes, it's $50. That's half the price it is at Minute Clinic. If it's over that, it's $99. So many people, the young people, the really healthy people, will choose this one. That's perfectly fine. You can always go up to another plan if you want, or go down another plan. The second thing you get out of your monthly premium is you get the annual physical. You also get to have a built-in visit. In this one, it's one, and I'll show you the others. The third thing is you get what I call our experience care perks. That's knowing you're going to call on the phone at any time and you're going to have a doctor. You're not going to have an answering service. It's knowing that you can have the same-day visits. All of the good things that we're giving you are included in each one of those. So we think that it's worth a lot. Even if it's $1 a day, knowing you've got somebody answering the phone at night, that's cheaper than you can get an alarm system on your house to answer you. Premier Care, most people are Premier. Premier Care is chronic care throughout the year. If you have a chronic or 2 or 3 chronic diseases, if you need prescription refills, like 3 medicines or just prescription refills where you need to come in 3 or 4 times a month, what we've done is package this up in one nice package. Again, you don't have to worry about it. It includes a more comprehensive physical because you're going to need that, and it includes more things in the package. It includes closer watch from the outside. It includes helping you do these stupid authorizations and prescriptions over the phone. We do that at no extra charge for you in this group. It does all of that, and it includes 3 visits per year. Now, I will be happy to itemize these things out for cost for you, but there's $900 worth of services in the first one, and in this one there's $1,800, and in the big one is $3,000. So a lot of things you're getting at no cost on these. So this is the second one, and you can read what it's all about. This is closer care. This is watching you. This is what we're doing. And concierge care is totally worry-free. Now, concierge care is $200 a month. I wanted to charge $199. Dr. Forkin insisted on $200. So if you don't like the fee and the extra $1, explain it to her. I thought $199 sounded very economical, and she thought it sounded cheap. So that's the way it is. Anyhow, concierge care, we are surprised. We thought this would be just for the executives or the very few. And what we're finding out is we're having more and more people sign up for concierge. The reason? It includes 11 visits. It's the best package we have for prevention. It's essentially a personal phone number that you can reach your own doctor, not one of the 4 of us. It's worry-free care, and it is for the executive. It is for the person who doesn't have time to go and wait in an office that needs to be in. It's time for somebody not to count, as my friend Debbie, wherever she is in the room, says, I don't want to have to keep track of my visits. I want to know I can go in. It's for the fragile elderly people or the people that need monthly visits or whatever. We're having several packages on concierge care bought for a parent by a child. Who says, Mom, I want you to stay in your own home. I want to know that you can see the doctor anytime you want to. And those are gift packages. So this has been a kind of an interesting one for us to be able to realize that it's more popular than we thought it would be. So this is the person that says, what's a year of my life worth? $2,400? Maybe on that. And so that's what this package is. Now, some of the questions. So those are our packages. We also have the junior and newborn. I never spend any time on this because I don't do children. But the good thing is that you can come as a family and you can package it together, and you will save a lot of money by doing that. And Dr. Forkin and Dr. Robert can tell you more. This is a list of some of our fees and the savings you get. Now, you have a choice, and I want to make this so very clear because people don't understand it. You have a choice on your labs. We will not bill Medicare or your insurance company for your services with us. but your labs can all be billed to Medicare because we have a private lab that's going in with us. So if you want your insurance to be your labs billed to your insurance company or to Medicare, everything can be done. So that is good. You don't have to say, well, what if I have more and more? What's it going to cost me? Some people will, but we can't do Medicare on it, and that's the only, let me try this again. Your Medicare labs can all be billed, and all your other Medicare things, EKGs, chest x-rays, everything else you want, you can have those done by another company besides ours. The thing that we will not bill is your office visit or your exam, but those are included in our package price. So people are confused about that. This particular thing, you can say, I want to pay the cash price. Instead of going to my dermatologist to have something removed from my skin and the bill is $450, you can do it with us, and I don't know if that one's on there, but it's somewhere about, there's $59 or $80 or something like that. So you can pay cash for that, and you're going to save up to 70%. If you want to have it billed to your insurance company and go to someplace else, certainly feel free to do it. But this is a cash thing we have that's going to save money. This does a lot of good if you have people that come in that need, like drug testing for medicines that they're on. Those tests are really expensive, and if you have a high deductible, you're paying it cash. This way it can be done very inexpensively, and you can save a lot of money on our cash prices. So those are just some examples. So now what we've covered is a couple of things. One is, how does this benefit me? Well, it benefits you by having a doctor close to you that you trust to live longer, to enjoy your life, to have more independence and more security, and help navigate this confusing world of going to 5 specialists in 6 different locations. That's number one. Number two, it benefits you by going to the office and feeling so comfortable and enjoying it and enjoying your time on it. So you get all of these perks of concierge care at a price that is affordable. And then the third one it benefits you is you can, even though there's some cost to it, there can be savings realized. And I'm going to go over that right now. Okay, so how can you save on insurance? Well, if you have a family of 4, you're paying a lot. In fact, the average family pays about $24,000 in insurance premiums a year. What you can do with our practice is you can then get a higher deductible, because most of these things are all things done in the primary care office. You're paying us separately, so you don't need to have that high deductible. All you need is a wraparound policy for the hospital for catastrophic care. You can save that, and here you can see what the savings are. These people will save $10,000 if they have a high deductible. Now, you say, well, what if we go into the hospital? Well, that is an option, but the odds are low, just like your homers and your auto insurance. But this is we've got you covered in the office, so you can save money that way. So if you pair it with a cheaper catastrophic insurance plan, significant savings. Okay, labs we just talked about. The old practice, you can see, and these are just, if you would put the $700 means you're paying for the classic care, those are our fees. But the labs, when they're non-covered, most of the people, you guys have all had physicals, right? You get your lab bill, it's like $250 for labs. And that's okay if your insurance pays them, but many times you get them denied because they're not preventative care labs. Well, now what you can do is, if you have a high deductible insurance, you can say, I think I'm going to have the cash labs for $100. I get the same thing. I was going to pay it anyhow because my deductible is not met. And you can save a lot of money by doing that. By the way, anybody notice that the deductibles are going up next year? The premiums are going up for insurance, and the deductibles they predict by another 24%. So it's going to you're going to see $5,000, $10,000, $15,000 on deductibles. I signed my cat up for Obamacare just to see what it would cost. So I put in Audrey Habig on that thing, and signed that up. And she's not 57 years old, but I put her in as 57-year-old single female. And it came back that her premiums would be $800 a month, and she would have $6,000 deductible, and that would pay for 60%. So who can afford that? Certainly not Audrey. I spend too much money on cat food for her. Okay, and then Medicare. Now, this is our big bugaboo, because the people that need this program the most are the Medicare people, which I dearly love. That's my thing. But unfortunately, one, they've already bought their insurance and stuff and they don't want to pay extra for it, or they don't realize the value, or as one lady said, I'm so sorry, I have to change doctors. I could afford to come to you, but I'd have to give up my glass of wine at night, and I think it keeps my blood pressure down. Probably not a good person to be in our plan. So you say, how can I do this, and then how can I afford it? Well, you can see if you can afford it. But one thing you can do is the Medicare co-insurance. Many times you can save money, again, with a different plan, because we're covering most of the things in the office. Most insurance people will try to sell you the higher plans, which you don't need. We've been working with Cicero Insurance. I don't know if they're here tonight, but it's a small group up in Cicero, and they've gone through what we're doing, and they can find ways to help save money on selecting your plans for you, and I'm sure some of the other people will too. But for many Medicare people, Medicare, I should mention one more thing about the whole thing here, is HSAs, we are fully compatible with the health savings accounts and the flexible spending accounts, so that's fine. The only difference is you can pay for the other plans on a monthly basis, but if you have an HSA, they recommend 6 months or a year to qualify for that. But we will give each one of you a statement when you leave. It is coded, it is ready to drop into an envelope and send to your insurance company. If you have out-of-network benefits, and some people do and some people don't, you send it in, you don't have to fill any paperwork out, and many times they will send you back and reimburse you. That's going to depend on your insurance company. We don't like to promise it, but when you're looking for insurance over the next 2 months, if you're coming with us, then select the out-of-network benefits. So you can get help with savings on this 3 different ways. By getting an insurance premium that has a higher deductible, by saving on the labs so that you don't have to spend that and make better decisions, by staying out of the hospital and not going to an emergency room. One of my patients, Kelly, I don't know if she's here, went to the emergency room and spent $13,000 before she came out and found out that she'd taken too many Tylenol PM, something we could have figured out in the office. So that's another way you can save. And then the next one is you can send in your statements that will be prepared for you if you have out-of-network benefits, which some Medicare replacement plans have, and see if you can get reimbursed back. But it may cost you more, especially Medicare, and the question is it worth it? And that's the answer that you're going to need to answer, the question you need to answer. So put all of these things together, and I've just told you how you can help save money on all of these things. I'm going to read a letter to you, and then I'm going to step down. This may not be something that you think is for you right now, but there will be a time when you're sick, you don't know what's wrong, and you got to have somebody you can trust to help you, and you don't want to go to the drugstore or to an unfamiliar doctor. When you're navigating a confusing healthcare system and a bunch of specialists and a bunch of diagnostics, or what I find is when a person is having grief, they need somebody to share it, and you don't want to roll the dice. I want to give you a letter quickly, and then my time is up here. But I think this is important to try to understand, and I hope this helps you navigate this. We want you to experience care. It's December 3rd, 2016. I just returned home from seeing my favorite doctor in Westfield. I was somewhat apprehensive as they started that independent practice called Westfield Premier. I didn't know what to expect. A few months ago, I got a letter indicating the practice would change and I could be part of it or find a new doctor. Well, you know, at our ages, finding a new doctor is like finding a new husband. We don't have a lot of years left to make mistakes, like having the wrong doctor. Well, I signed up for the program. It cost me more, but I just cut out 1 coffee a day, and boy, has it been worth it. I pay for the program on a monthly basis, but it's a year-long commitment, which focuses on me and my well-being. I love the fact that I pay by the month, and I sleep better at night, knowing I'm covered if something happens. I'm part of her flock, and day and night she is there when I need her. I went to my 9 o'clock appointment with my blanket pillow and my novel, as I knew she would be late by then. Something was different. When I drove in, the parking lot was newly paved, and that awful ramp was replaced by a modern, easy access entry. I didn't have to worry about stepping off that darn thing anymore. And the medical building now looks like a library with its landscaping, even has rose bushes with the snow resting on them. As I went in, I noticed a new carpet with even a drip mat for my boots. What a good idea, no slipping or dragging in the dirt. The entry hall has bookshelves with books I can take or leave. Fresh water and coffee are right in front of me, and the waiting room is changed. I could have sworn I'd entered a fine hotel lobby. Yes, real plants with beautiful flowers, sunlight streaming in those big windows I never could see before because the blinds were down. And there was artwork, comfortable chairs, and music, and I think the smell of maybe fresh bread in the air. I didn't see anybody else in the waiting room, and the strangest thing, there were no phones ringing, and there was no stacks of papers around. I sat down, and just for a second, and Brandy, Dr. Forkin's nurse, greeted me wearing a smart little jacket and real trousers, neat trousers. She asked if I would like a cup of coffee or tea and escorted me right out of the waiting room to a newly furnished exam room. Brandy and I talked about the kids and the grandkids, and then she took my vitals and asked me some questions. Again, no papers, no worried look on her face, as she was overwhelmed. Within minutes, Dr. Forkin appeared, so relaxed she looks 10 years younger. I told her what was bothering me, and she spent the longest time going over her thoughts and findings and obtained some tests and discussed the options and her treatment recommendations. She knew I was worried about that lump and was so glad I'd known Dr. Forkin for so long. The security that she will take care of the problem, whatever it is such a relief. If I have to have surgery or see other doctors, I know Dr. Forkin will be right there with me and not just send me to a bunch of doctors I don't even know. That can be so frightening, like going on a blind date in junior high. After all the testing arrangements were made, Dr. Forkin assured me that she would be in contact as soon as my test was completed. She would even call the x-ray doctor and speak to them on my behalf. It's like having a friend with you all the time. As I left, I felt like something was missing. I never filled out any paperwork, and I never felt rushed. I didn't even have to stop at the front desk. With my monthly plan, I don't even take my checkbook to the office. Wow, that was easy. Now maybe I can sit down in the lounge and enjoy that cup of tea while I watch the snow come down. I hope you can experience care and not have to worry about who has got your health covered in the future. Take care. Love, Marge. This is why we're doing what we're doing. Thank you.
So here we are. We're going to break in just a few moments here, and we have some refreshments, and we'll be out in the lobby, and hopefully if you have any other questions. But there's the why. There's the why. Why? We want to do a better job for you. And I think we're doing a good job now, but we're running out of time to do that thorough, complete job we all want to do for you. And that's where our hearts and our roots are. So this is a new wave. We've had a retired doctor call us who actually had to leave practice because he was fed up with, again, the gorilla I referred to earlier, and says, hey, what are you folks doing down there? Would there be any room for any even part-time? I miss it. I want to back in. So certainly a wave that might draw physicians back in. And again, Dr. Hone in 92, amazing. I don't think I'll be practicing in 92. Elaine will, but I won't. We've had a younger doctor who is absolutely frustrated. He is roped into a 5-year contract. He hates it with a hospital. He's told when to be there, when to leave, how many people he can have working for him, how many people he's got to see. Okay? This is not what he envisioned. He's contacted and said, hey, is there any way? We sprouted some wings. We're going to soar. Got my aviation background there. I love it. But we want you to be with us. Does anybody remember Ambassador? Look at this. This is wonderful. We had the opportunity to be. Those of you who didn't know, Ambassador was a wonderful flying and travel club. It was owned by American Transair. Unfortunately, American Transair came into some financial troubles back there, and they had to again close down. Ambassador was bought by a different travel agency. Ambassador was very unique, and it really is almost what pattern. It struck me that last week when I got thinking about this, because for really basically a small annual fee, they sent you this beautiful color brochure that had wonderful trips, and it was all about the trip. There were no hidden costs. You knew what you were paying, you know when you were going, you know the transportation, your hotels you were staying at. There were no secrets. There was no hidden costs. You got what you paid for. They were on time. They were direct. There were no waiting in airports. The transportation on the other end of it was wonderful. It was always there. It was a wonderful travel club. And there was only one drawback. We called sometimes to get on a trip, and they were full, and they'd sell out. Westfield Premier will have to limit our patients. We only have room for so many. And that's the problem. That's what took us, one of the reasons it took us 2 years to get here, is what are we going to say for 2/3 of our practices we cannot take on to make this model work? We have limited room, and it is filling up. We want you to come fly with us. We want you to experience health. We want you to invest in your health. You won't be sorry. This trip is going to be wild and wonderful, something you've never seen, something Westfield has never seen. So we invite you to come with us, be with us. It's going to be a trip of a lifetime. Thank you for your attention, listening very nicely to us. Your patience is, and just your presence here is an honor. And we're an honor to continue to serve this wonderful community. We'll look forward to seeing you in the interim. Thank you very much.